So again, my name's Ann Bailey. It's super exciting to be here with you all, to have the honor to lead the VA Immersive team. And I want to get a little more deeply into who we are in VHA and why this work makes a lot of sense based on where we sit in the organization. So for those of you who don't know, the Veterans Health Administration, I'm not sure if this is, you want me to try it pointing at that? This morning I was like pointing at all the directions and it worked. Okay, so there we go. Okay. The Veterans Health Administration, I don't want to assume that you all are familiar with who we are. Largest integrated healthcare system in the country, serving 9 million veterans, 171 medical centers, 1,200 sites of care, the largest provider of graduate medical education, major contributor to medical research. Also now confirmed last week, 400,000 staff, 25,000 active volunteers. So a lot of opportunity to get a lot of great work done and a lot of opportunity to continue to grow. Dr. Ripley mentioned a few of these things in her message as well. VHA also has a strong history of innovation. One of the first clinically successful implantable cardiac pacemakers was in the VA, the liver transplant, a powered ankle-foot prosthetic in the VA, and also the first compassionate use authorization from the FDA for a 3D printed hearing device. If you have not heard that story, that's more recent. The GeoStent, Dr. Ripley was a part of that, as well as some of the other team members who are here from the Office of Advanced Manufacturing. But it's a great VA story, a great VHA story. We heard earlier from the Deputy Assistant Undersecretary for Health, Dr. Susan Kirsch, who's a great advocate for immersive technology, and also acknowledged that the Assistant Undersecretary for Health was here as well, Dr. Carolyn Clancy. She will be back again likely later today, but certainly will be here to close the event. They oversee the Office of Discovery, Education, and Affiliate Networks, or the DEAN. Why does it make sense for immersive technology and the work that we've been doing to grow out of DEAN? Well, as you can see, they oversee Office of Research and Development, Office of Academic Affiliations, Healthcare Innovation and Learning, and Healthcare Advancement and Partnerships. So looking at that more closely, that's where we do our research and development. That's where we train. Our health professions training happens there. Healthcare innovation happens there. And our healthcare advancement happens there. I sit and get to work within the Office of Healthcare Innovation and Learning. And as you guys can imagine, 9 million veterans, 400,000 staff, largest integrated healthcare system in the country. We're a complex organization. Within our office, Office of Healthcare Innovation and Learning, we have 5 core programs. 4 core programs and a strategic initiatives lab that's really shared across the services. The Center for Care and Payment Innovation focuses, just like it says, on leaning into business and care models, innovation in that space. What are we doing now that maybe we need to think differently about doing as it relates to business and care models? Innovation Ecosystem is a group that focuses on workforce capacity and building that innovation muscle of our frontline staff, particularly leveraging a human-centered design approach, engaging our end users in the innovation in design. SimLearn, Simulation Learning Evaluation Assessment Research Network. I think I got that right. We've got some friends from SimLearn here. Correct me if I'm wrong. They also are doing some demos across the hall, so I hope you'll go see those. But SimLearn is where we think about simulation, training, and education. They have a beautiful building in Orlando where we hosted this event last year and also hosted a veteran experience event in December. Beautiful simulated hospital, but that's where we think about our clinical education and training. Then Office of Advanced Manufacturing, focusing on 3D printing and how do we make what we can't buy, is what they say. Our Strategic Initiatives Lab, focusing across all those areas. And how do we think about immersive technology in all those spaces? When it comes to immersive technology, we have the ability and the opportunity to think differently about our care and payment models, to engage our frontline staff, and build that innovation muscle as it relates to defining the landscape of immersive technology in healthcare. SimLearn, thinking differently about how we provide our education and training. David King Glassman said it when he was up here talking about his, but it makes a lot of sense to use immersive technology for simulation for a lot of different reasons. Advanced manufacturing is a complex service, and so can we leverage immersive technology to train and design and do those types of things? And the Strategic Initiatives Lab being able to scan and scale across all those groups and work together. More specifically, you've heard us talk about VA Immersive. So that is our program that sits within the office that is really overseeing this work. We are a team of 3 VA staff. We got to have, as we mentioned, got to have Kim for a little bit, but now through VA staff with a wonderful group of support staff that many of you have gotten to meet today and will get to meet over the next day and a half. But in our office, we oversee 18 pilots at 120 unique medical centers in 44 states. It's a lot of work, but it's a lot of fun. We get to hear, you'll hear a lot more about this over the next day and a half. I just want to do a high-level view because what you will hear starting this afternoon with Caitlin Rollins' presentation and ending with Evan Davis on the last day, you will hear the people that are doing this work, and you'll hear from the veterans being impacted by this work. In our network, our internal resource for our frontline staff, where we really work hard to equip and inform our staff to lower the barrier to adoption, we now have over 2,000 frontline staff engaged. We offer quarterly competencies that impacts over 20 different disciplines, and we offer 4 communities of practice. This time last year, we had 1 community of practice. We did not have any continuing education, and there were about 750 people in that network, so we're seeing incredible growth. But with those communities of practice, we're able to engage and provide training and education and information across the system. We also have collaborations with 6 different clinical program offices. As I mentioned, VHA is very complex, so we have the Office of Pain Management and the Office of Mental Health and Suicide Prevention and Prosthetics and Physical Medicine and Rehabilitation Service and Geriatrics and Extended Care. And we're able to partner with those offices who are subject matter experts in their clinical space, and we bring the subject matter expertise in immersive technology. We're also working with 3 other government agencies, showing the strength of the government working together, and 8 external companies, and many of those you can meet across the hall. What we get to do is design, co-develop together so that brilliant technology intersects with healthcare systems that ultimately impacts the patient in the most suitable way. You've heard often said already from this stage, you will continue to hear it, and we hope to see you post it for those of you who use social media, but heads and headsets. Dr. Kirsch came up with that phrase last year when we were talking through why does this work and how do we begin to understand it better? And it is that experience that helps you understand that psychological presence. We've also convened an executive roundtable to address many of the concerns and questions that some of you have brought up today, whether in the poll that we launched this morning that already has 35 responses, or from some of the questions asked earlier, and certainly questions that will be posed throughout the next day and a half. We had the opportunity in June to do a demo day on the Hill with Congress. You'll hear more about some feedback we received there. Of course, the VA Immersive Summit, you are here now. We are glad you're here with us. And also last year at the VA Immersive Summit, we had a veteran panel. They said, it's great that you're doing this for executive leadership, but are you doing this for veterans? And at the time we weren't. And so lesson learned, now we offer demo events for our veterans specifically. We call those Veteran Experience or VXR. In doing those events, we've learned that our employees actually appreciate that we do demo events for them. So now we call those the employee experience events. Thankfully, Evan, as a member of our team, has had the opportunity over the last several months to also attend the Veteran Service Organization conventions, and we'll certainly talk more about that. But that's been an incredible opportunity to actually go meet veterans with where they are. Our Veteran Service Organization community is critical to connecting with our veterans where they are. Now, we've used a lot of terms. We're already almost halfway through the first day. And I just want to level set on some of the ways that we use this terminology in VA. As you can imagine, common language really matters. What are you saying when you say something? So this is simply how we have defined this language. Immersive technology being the most expansive term. So anything that can help you believe you're in a reality other than your physical reality. Then we think a little more narrowly into extended reality. Again, an umbrella term for augmented reality and virtual reality. We don't in VA currently use the term mixed reality very often because we're still waiting for a more clear definition of what that term means. Also, with a new Apple device, you will hear the emergence of the term spatial computing. So we think over the next year or so, those words maybe become more clearly defined as headsets evolve, as we think differently about how we use these devices. But we just have decided on this more common terminology to really narrow the scope and focus. Now, I want to talk a little bit about the landscape and why this work matters and how we want to think well toward the horizon. We know that there's a projected growth of immersive technology in healthcare from $2.7 billion 3 years ago to $41 billion 3 years from now. That's a pretty expansive growth over a very short period of time, and that's specific to immersive technology in healthcare. I was also sent an article last week, really appreciate it, that mentioned the U.S. Army has invested or is proposing a $22 billion project related to head-mounted displays to equip the lowest level infantrymen with the skills of fighter pilots. There's two things that I think are really important in just this one phrase. One, $22 billion investment in head-mounted displays mean by the time we get our veterans, this technology will be native to them. And so it'll be a seamless integration into their healthcare system as we think about how we use it. I also think it shows a unique feature of the technology. If you can equip the lowest level infantrymen with some of the skills of our fighter pilots, how also could we think about that with some of our healthcare staff to address the access issues that we may have, where then we have our specialized clinicians, but we're also able to upskill some of our other staff members. And there's some really huge opportunities there. And then we know that we can learn faster, or we see that learners are also more confident to apply their skills and are more emotionally connected and more focused than their e-learning friends. Also very important when we think about how we learn. And as I mentioned before, research and development, academic affiliations, advancement and partnerships, healthcare innovation and learning. This is a beautiful space for these things to grow and be tested and advanced within the VA. One of the other things that I think is most exciting about this technology, and you'll hear Caitlin, Evan, and I all talk about this, is that are we collaborating or are we competing? We want to collaborate, and that is our absolute goal. And we find that this technology is particularly powerful when it comes to convening a large group of diverse people. I mentioned briefly the XR Network. Caitlin will certainly go more deeply into that, but that's our VA community where we share resources, lessons learned, opportunities. So much of what we have here at the Immersive Summit and that you will hear about has grown up from our frontline staff in the XR Network. But just to feature some of the diversity, and again, this number changes every day. This is just where it was when I created this slide deck last week, but we had about 1,648 clinical staff. And you can see in this list of titles how diverse those clinical staff are. Clinical psychologists, wound care specialists, associate chief nurse, creative arts therapist, chiropractor, acupuncturist. This doesn't even really encompass some of the more common: doctors, nurses, pharmacists, social workers, physical therapists, occupational therapists. We have representation from all. We have dentists in the group as well. Non-clinical, we have a smaller population, but biomedical engineers, industrial engineers, caregiver support coordinators. Really powerful opportunity there. Police officers, we've worked to develop a firearm safety experience that we engaged our police officers to help us make sure we were using the correct terminology. Whole health coordinators, a feature of VA is we want to provide whole health care, not just reactive health care. Innovation specialists, some of those are in the room, many innovation specialists in town today and this week for graduation. Veteran experience officers. You will actually hear from the Veteran Experience Office. They've done some development with us, and they have a demo over in the exhibitor hall, so we hope you'll connect with them. Researchers. We mentioned earlier, Dr. Greenleaf mentioned it as well. You will hear from Dr. Persky from the NIH, as well as a panel that we'll have tomorrow with NIH, FDA, Stanford with Dr. Greenleaf, and we'll talk through some of the regulatory things that we're thinking about as well as research. But we do have researchers in this group as well. Health science researchers, user experience researchers, clinical nurse researchers. There's a great diversity there. And then training, education, and simulation. It just makes sense, right? This is a great space for us to use immersive technology. Is there any group of people that should be represented here that you don't see on this list? Veterans. They're also in all of these groups. And so our end users are inherently engaged in our community. You see the same type of diversity among you all. Again, when I started doing the slide deck, full disclosure, it was due on Monday, and I also started it on Monday. Please see previous comment about 18 pilots, 120 medical centers, 44 unique states. Over the course of the week from Monday to Friday, and I actually turned it in, it went from 650 to 720 people at this event, joining us both in person and virtually. And actually today, in looking, it's, I believe, over 760 people, so we continue to add people. We actually have added the link to virtual attendance to our away message, so if you know others who need to listen in, feel free to have them reach out to us and they can join us virtually. But among you all, this is how the breakdown goes. 79% are government. That includes active duty service members. It includes, of course, our VA Central Office, which is just around the corner. VISNs, which are regions of medical centers, healthcare systems, and sites of care for VA. VA Medical Center leadership, I've talked to many of you today and are so grateful for your support and enthusiasm, because if there's no leadership or enthusiasm at the medical center, it doesn't matter what we're doing at Central Office. We have to be engaged with our actual end users. Industry, so many of them have exhibitor space over here, software and hardware. And by hardware, it's not just headsets. We have infection control over here as well. And those are important pieces of the puzzle and people to bring into the conversation. Academia, you heard from Dr. Greenleaf earlier from Stanford. You'll hear from others, UCLA, Harvard, and others. And then veteran service organizations and other healthcare systems are attending as well. And again, in all of those spaces, veterans are represented. So how have we moved from what we say, we're defining a new reality in healthcare experience and delivery, to now experiencing a new reality? Our undersecretary, who is our boss, for those of you not very familiar with how VA works, has asked us, in addition to his 6 priorities, to think specifically about immersive technology as it relates to pain management, behavioral health, physical rehabilitation, and also the opportunity with training. So these are quick examples. Again, others will go more deeply into these, but just to give you a quick overview, one example of an opportunity we have with mental health is actually involves some co-design and co-development, but chronic pain and suicide prevention, 60 different sites. This one is unique because we have 3 VA clinicians who are the subject matter experts contributing to some of the content development, so that we know what our veterans are able to put their heads, when they put their heads in headsets, that content was designed and developed with them in mind. Pain management, we have the opportunity to do an at-home pain management pilot. That was a question many of you asked about where VA should lean into going forward. We completely agree with you. And this is one of our opportunities to try that. 14 different sites, pain management coordinators, and again, an at-home device, which is really exciting and unique. Physical rehabilitation, we have several projects actually in this space. One is 9 unique sites and really digging into that business and care model. We really think this is a great opportunity to improve patient outcomes, but also decrease costs of care, avoid unnecessary procedures. And then training. VA has had the opportunity to develop 3 VA-specific training experiences. You can demo those across the hall. One, Moments That Matter, is the one we were able to do with the Veteran Experience Office. They'll talk more deeply about that, but just recognizing and appreciating the challenge that is inpatient discharge. And how do we help improve the patient's experience? One way is to really frustrate the people that are helping those veterans walk through those scenarios. By that we mean walk through the same experience that our veterans go through so they can have that empathy and understand better. Firearm safe handling. We know that one of the #1 ways to prevent suicide is lethal means safety. But for so many reasons, we can't force people to handle weapons or even become familiar with them. But we know in a virtual environment, they're able to learn the language, learn to safely arm, disarm, and lock weapons. Learn to respond, but also learn to stop harassing people. And what does that look like in that training experience? We've gotten phenomenal feedback. We've done some end user testing at 4 different medical centers and have 2 more that we're planning now. All this to say, at the end of the day, why does it matter? Because of all these pictures and people. You'll hear more about the patient outcomes, patient-reported outcomes, the clinician experience. But at the end of the day, the number of times we see people's faces transform when they go into these experiences is not small. And we're able to do this because we do it together. So with that, I want to offer you the opportunity to ask questions. Happy to field things. I don't have my phone to look at the ones online, so I'm counting on you all that are managing the phones back there to let us know if there's online questions. but I'll open the floor. I also appreciate that somehow I always end up between you and lunch, so.
Hi, Dr. Bailey. How persistent is this training with regard to, a given condition such as the ones you had up on there on the screen, knowing that it probably varies from condition to condition?
Yeah. So you mean when you go through the training, how long does the retention last?
Yeah.
That's a great question. So that's one of the things we're continuing to evaluate. With these three experiences, empathy training are two of them, and then skills training is another. So when we think about the firearms experience, it's learning language. The beauty of these experiences is that with a headset, you can repeat it. So if it's perishable knowledge, you go through the experience again. We're still, I would say, and I think Dr. Persky is going to get into this a little bit, about how long knowledge gained in immersive environments lasts. Walter touched on it as well. But the beauty is because of the psychological presence, you actually retain it longer based on some of the studies that exist now than if you're learning in a 2D environment. That's a great question. So for those of you online or who may not have heard, he was asking about post-COVID world, where we're trying to actually get people to engage more with others and not just be in a virtual environment. How does that work with this technology? One of the interesting things I think that we have continue to see, is that while there's certainly opportunities for it to be isolating technology, there's also a lot of opportunities for it to be connecting technology. So you can see some of the experiences across the way where you may be able to join peer environments where you meet with other peers and connect in that space. And actually there's some testimonies, I know Noah would be happy to share those with you, from combat veterans who are actually isolated, socially isolated, were able to join with other veterans or active duty service members and then progress to connecting with people in real life. That's a study I would love to do if we're able to actually track that sort of connection, not only from isolation to social connection, but then also connection to care if they need that step up in mental health care or otherwise. We also want to make sure that we are being mindful of those types of things and who we encourage or allow to use the technology. And then where we can, leverage the ability to connect people in those environments intentionally. The creative arts experience that we have, it's at 73 different sites, and it's actually multi-user experience. So veterans at other VAs can actually join in those creative arts experiences at the same time for that connection. So if anyone has a sort of a social phobia or resistance, they're able to connect in those spaces.
Apology.
That's okay.
If I'm working with somebody with anxiety or depression and I'm trying to get them back out in the community, I'm using the headset, is there going to be an addictive nature for them to want to hang out in this environment versus actually getting out in the real world environment?
That's where this augments clinicians and doesn't replace clinicians. That's where it's really important to stay connected with your patient, to understand the individual patient and their need, any sort of sensitivities or tendencies they might have toward that sort of addictive behavior. So that's a great point. Any other questions? Do we have any questions online? Mary? None? Okay. Well, I can tell you all are eager for lunch, which is fine with me. So we'll dismiss you to lunch. We'll join back here at 12:30. We have we think, potentially a surprise guest at 1 o'clock today. So join us back here at 12:30. If you need recommendations, we certainly have those available. I look forward to seeing you this afternoon. Thank you so much.